My name is Dr. Rabinowitz. I'm a board-certified plastic and reconstructive surgeon, as well as board-certified hand and microsurgeon. Thumb arthritis is a very common arthritic condition. It's the second most common in the hand besides these last joints before the fingernail. It's an arthritis that affects women 5 times as much as men, unfortunately. And it's an arthritis at the base of the thumb, so it's right in this area over here. And typically, it presents as pain and weakness of the thumb. Diagnosis of thumb arthritis is both clinical and radiographic. Typically, the physical examination and history, 95% of the time will tell us what it is. But we usually confirm with a plain x-ray. We usually don't need to get specialized tests like MRI scan or CAT scan. The treatment for thumb arthritis mirrors treatment for most hand problems. We always try to start conservatively with rest, splinting, anti-inflammatory agents. And if that works, terrific, we stop there. If that's not enough, or if the patient finds that the arthritis prevents them from doing things they like to do, whether at work or activities or sports, then the next step for me is usually surgery. When considering surgery for thumb arthritis, I think the biggest question the patient needs to ask themselves is, how much is this arthritis affecting my activities of daily living, my life in general? And I always tell them that once it gets to the point where you find every minute of the day you're thinking about, oh, this thumb arthritis is preventing me from doing this or that, I think that's the time to consider it. The operative procedure for thumb arthritis has been an evolving procedure. The way I treat it now is vastly different than the way I treated it 30 years ago. And I've really adopted the most kind of cutting edge approach and techniques for this. It's still an operative procedure, but my operative time is down to about an hour now, whereas it used to be 2 hours or so. And we make a very small incision, and we remove the arthritis, but now we use a very sophisticated reconstructive method using bone anchors. It's what's called an internal brace. And that really is the most cutting edge of the techniques for this, and I find that it does a number of things. One, it shortens the operative procedure. 2, the recovery time is cut nearly in half. The patients have very minimal pain, and they get all their function back, including their strength and motion, within 6 weeks. For thumb arthritis surgery, it is a same-day surgical procedure. It is typically done with the patients either in twilight sleep or fully asleep with anesthesia. The procedure itself takes about an hour, and typically they go home about an hour to an hour and a half following the surgical procedure. Fortunately, surgery for thumb arthritis is incredibly effective. Our success rates really approach 95%. We can expect the patients to have full motion of their thumb. Most importantly, they have no pain in their thumb. And within a very short period of time, meaning 6 weeks or so, they get most of their strength back. And so they can go back to all the activities they wish to do, at that 6 to at most usually 8-week mark.